GP focused on women's health here in Hong Kong. When we talk about women's health in our late 30s, 40s and beyond, bone health often gets a backseat to other concerns. But did you know that preventing osteoporosis, the weakening of bones, is one of the most critical steps you can take for your long-term independence? Many women assume that standard menopause hormone therapy, or MHT, is the only way to protect their bones. While MHT is a fantastic option for many, it's not the only option, and it's not suitable for everyone. Today we're going to explore some highly effective approved medical treatments for osteoporosis prevention that go beyond standard MHT. Before we begin, let's remember that this video is for educational purposes only and does not constitute medical advice. Always speak to your healthcare provider or doctor to determine what is right for you. Whether you're listening on Spotify, watching on YouTube, or scrolling through Facebook, this information could change how you approach your bone health. First, let's get clear on what we are trying to achieve. When it comes to bone health, we categorize things into prevention and treatment. If you have osteopenia, which simply means low bone mass, our goal is prevention. We want to stop further bone loss. If you already have established osteoporosis, our goal shifts to treatment to actively prevent fractures. Regardless of where you are on that spectrum, the foundation of bone health is the same for all of us. You need adequate calcium, about 1,000 to 1,200 milligrams a day, preferably from your diet. You need vitamin D to help absorb that calcium. And you must engage in weight-bearing and muscle strengthening exercises. But what happens when lifestyle isn't enough to prevent bone loss and standard hormone therapy isn't the right fit for you? Let's explore why standard MHT might not work for some women and look at the alternatives. For women who still have their uterus, taking standard estrogen therapy means you must take a progestogen to protect the uterine lining. However, up to 20% of women experience what we call severe progestogen intolerance. This can feel like extreme PMS, profound fatigue, mood swings, depressive symptoms, bloating, and severe breast tenderness. For these women, standard hormone therapy can feel unbearable, leading many to abandon treatment altogether. If you need bone protection and symptom control, but become depressed or fatigued on standard progestogens, what are your options? One approach is to change how the hormone is delivered. For example, using a hormone-releasing intrauterine system or using micronized progesterone vaginally to keep the hormone localized to the pelvis and out of your systemic circulation. But if you still cannot tolerate progestogens, we look to entirely different classes of medications, SERMs and STEARs. Let's break these down. Let's start with SERMs, which stands for Selective Estrogen Receptor Modulators. The most common one is called Raloxifene. Think of Raloxifene as a very smart medication. It acts like estrogen in your bones, protecting them from breaking down, but it acts as an anti-estrogen in your breast tissue and uterus. This means you don't need a progestogen at all, and it actively protects against certain types of breast cancer. So who is the ideal candidate for a SERM like Raloxifene? If you're an older postmenopausal woman, perhaps in your 60s, and you are not suffering from hot flashes or night sweats, this could be for you. If you have osteopenia and a strong family history of breast cancer, Raloxifene is an excellent choice because it protects your bones while simultaneously reducing your breast cancer risk. However, there's a catch. Because it acts as an anti-estrogen in the brain, it does not relieve menopause symptoms. In fact, it can sometimes cause or worsen hot flashes. So, if you're highly symptomatic, this is not the medication for you. Now, let's take a look at a completely different option called Tibolone. Tibolone is a STEAR, a selective tissue estrogenic activity regulator. Tibolone is quite unique. Once you take it, your body metabolizes it into 3 different compounds that provide estrogen-like, progesterone-like, and weak testosterone-like effects. Because it's tissue selective, it protects your bones without stimulating the lining of your uterus, entirely eliminating the need for a separate progestin. This makes it a fantastic option for women with severe progestogen intolerance. Who should consider Tibolone? This is generally an excellent option for younger postmenopausal women usually under the age of 60 or within 10 years of menopause. If you're struggling with low libido or sexual desire, Tibolone is often superior to standard hormone therapy because of that weak testosterone-like effect. If you have tried standard hormone therapy and suffered from extreme breast tenderness, or if you simply cannot tolerate the irregular bleeding that sometimes comes with starting MHT, Tibolone might be a much better fit. It tends to stop bleeding much faster and doesn't increase breast density. It is important to note, however, that Tibolone is not suitable if you have a personal history of breast cancer or if you're over 60 due to a slightly increased risk of stroke in older age groups. There are a couple of other options worth mentioning briefly. TSECs, or tissue-selective estrogen complexes, combine estrogen with a medication called Bisphosphonates that protects the uterus without needing a progestin. While this is a great progestogen-free option, it is important to note that Bisphosphonates is currently not available here in Hong Kong. And for women who have clinical risk factors for fractures but don't quite need full osteoporosis treatment yet, or for those coming off hormone therapy, medications called bisphosphonates can sometimes be used to prevent rapid bone loss. The main takeaway today is that bone health is not a one-size-fits-all solution. Your treatment should be as unique as you are. Whether you fit the profile for standard MHT, the breast-protecting benefits of Raloxifene, or the symptom-relieving, libido-boosting effects of Tibolone, there are saved, approved medical options available to keep your bones strong. If you're a woman in Hong Kong aged 35 or older, now is the time to start thinking about your bone health. Talk to your doctor or healthcare provider. Ask about your bone density and discuss which prevention strategy fits your specific symptoms, your family history, and your lifestyle. Thank you so much for joining me today. If you found this helpful, please share it with the women in your life, save this video, and subscribe for more evidence-based women's health discussions. Take care of yourselves and take care of your bones.